Welcome to Pharmative Live. I'm Dr. James Partyka. I'm a clinical pharmacist, oncology research scientist, and the founder of Pharmative.com. And this is Pharmative Live, streaming to you live from Palm Springs, California. Today's topic is going to be COVID-19, seeing the light at the end of the tunnel. And I say that cautiously. But we're going to kind of sort of do a look back at where we were a year and a half ago to where we are now and look towards the future of research for COVID-19 disease. But before I begin, I just want to remind you of our sponsor, which is PNN.1 Plus Health mobile app. You can download your app at your local Apple and Android stores today. Not only does it have great music with Pride Nation Radio at pnn.fm, but it also has a number of vital healthcare resource tools, information coming to you from the FDA, the CDC, the National Cancer Institute, the National Institute of Health. It also has a doctor symptom checker, an application that you can check for the lowest cost drug in your neighborhood. And if you are in need of finding a clinical trial, there's that there as well in your PNN.1 Plus Health mobile app. So today is our last episode of the season 3. We will go into reruns until the fall. And I just want to remind all of our viewers out there, and I want to say hello to Helen and Jimmy and Alan out there, that you can continue to be in touch with us through, first of all, my email at info@pharmative.com. You can always send me your comments and questions through that email. Also, you can come right here to our Facebook Pharmative page, where we will continue to post information about the pandemic and other healthcare topics. Also, Pharmative.com, which is the first social media network dedicated to your healthcare. Please join. Membership is forever free. And there's always Pharmative YouTube, where you can replay not only videos for Pharmative Live, but other healthcare-related videos at Pharmative YouTube. So a lot is going on with Pharmative and PNN Media, so we're kind of excited for the future. We're going to be launching in the fall also a new talk show, which is going to have guests and talk about things happening in the Palm Springs, Los Angeles area, talk somewhat about current events, and have some amazing guests. And the great thing about Palm Springs is there's a lot of interesting people, very creative people. We already have a lineup of guests that we're planning for. We're working on our new set, which is exciting. And so a lot of great things are happening for both Pharmative and PNN Media. And we want to thank you for your loyalty. And hopefully, I always say, if I can touch one person and give the right information at the right time to improve their lives, then it's all worth all the hard work that the Pharmative care team puts in, our consultants put in as well as Jimmy. And we move forward in time, and I'm really proud of what we've accomplished so far in a few short 5 years. So that's Pharmative Live. We'll be resuming with season 4 sometime in the fall. So I last time reminded you of our Pharmative vaccine challenge, which was to go out and find someone who wasn't vaccinated, whether that be a family member, a friend, or a neighbor, and see if you can convince them to get vaccinated. And I did receive a number of success stories, one of which I'm going to read to you. It comes from Tom in California, who has a wonderful friendship with his housekeeper and was able to convince her the importance of getting the vaccine to prevent COVID-19 disease, not only because of the short-term complications, but also the long-term complications as well. He offered her even a ride to go to the pharmacy to get the vaccination, but she had her own car, so that she didn't take him up on that. But not only did she end up getting vaccinated, she ended up making sure that each of her family members were vaccinated as well. So during our hiatus, I just want to remind you to continue doing the Pharmative Vaccine Challenge. Remember, you can text your zip code to GETVAX, GETVAX, and that will give you, within seconds, a list of pharmacies and clinics where you can get vaccinated in your area. And, you know, we've been talking over the past year about ever since the vaccines have been available since December of last year, the importance of getting vaccinating to prevent not only you from getting the disease, but from your family and your community members from getting disease as well, to basically block the spread of disease. And that's what's really known as herd immunity. We still want to get to that 75% threshold, or about that magic number of 75%, so that we can really prevent the spread of disease throughout our nation. And we're going to go over some numbers in a few minutes. I also wanted to take this time to just remind you to keep a healthcare journal, whether that be a hard copy notebook, or whether that be the notepad on your smartphone or on your iPad. And in that healthcare journal, just list your name, your contact info, basically your height, your weight, your age, your race, and current medications you're on, allergies that you may or may not have, food allergies, and then a list of medical conditions. And just start with your current medical conditions, a list of your medications with their dosages, and any other important notes, including your vaccination history. And what's great about doing that on the smartphone or your iPad is you can actually take a photo of your vaccination card, or you can even scan it into your notepad directly, or you could scan laboratory reports that may be important. A healthcare journal is really important in making sure that the information is relayed to the appropriate healthcare workers at the appropriate time to minimize medical mistakes, medication errors, but also, as you see, additional doctors, specialty doctors, try to always go to just one pharmacy so that they can keep track of all your medications in one location. But it's very helpful also for chronic illnesses such as diabetes or cancer, or even those people that did acquire COVID-19 disease. Again, to keep track of your progress, your symptoms, how you're tolerating your medications. And again, it can be so simple, just a date and a couple of words of a description of what you're experiencing. And again, I find it very useful to have. My vaccination record now is in my journal. It took me 5 to 10 minutes to create. And now I'm in the process of getting the shingle shot, which are 2 shots separated by 2 months or more. And I'm due for my second shot early on, and I can just go into my healthcare pad and figure out the exact date when I got my first shot. Very helpful. Over 100,000 Americans die every year to medication errors and mistakes. That's a startling number, startling statistics. And our healthcare system, I think one thing that COVID-19 brought out to us, and we've discussed this before, is the disparity and the lack of access that some people have to healthcare, to doctors and nurses and pharmacists, and the disparities in health outcomes. People that are Black or brown, people that have comorbidities have a higher mortality rate to COVID-19 disease. So again, we have a complicated healthcare system, and whatever we can do to streamline our services, improve access for our loved ones is so important, again, as we're dealing with these chronic illnesses, such as the pandemic of COVID-19. So again, keep a healthcare journal, whether that be on a hard notebook tablet, which might make you feel safer and more secure, or whether that be on your phone or your tablet. Okay, let's review some numbers. Today is June 6th, 2021, all right? The total number of COVID-19 cases to date is 33.4 million Americans. That's a huge number. That's a huge portion of American citizens. And as far as the total number of deaths is, unfortunately, over 597,000 deaths. So we are approaching that 600,000 mark. Again, that's very startling and very disturbing. So COVID-19 has a high degree of mortality and morbidity associated with this disease, and is ongoing. So even though I'm optimistic, I'll say cautiously optimistic, as we get more and more people vaccinated, we're still going to have to be vigilant in monitoring for the variants of COVID-19 disease, as well as for outbreaks. I'm going to talk a little bit more about that in a few minutes. Now, the good news is that over 51% of Americans have received at least one dose of vaccine, and 41% of Americans are fully vaccinated. So those are the good news. And what we saw in the clinical trial data, remember there were a number of large phase 3 trials where patients were randomized to the vaccine versus placebo. And we saw a reduction in those people acquiring COVID-19. We saw a reduction in moderate to severe disease, as well as hospitalization and deaths. And what we see by more and more Americans becoming vaccinated, the trends, the epidemiologic trends, we see a decrease in cases and a decrease in deaths. So that refers to the generalizability of the data. From the clinical trials, we have 3 safe and efficacious vaccines that have been approved for national emergency use for adults as well as teenagers 12 years of age and older. So anyone who is not vaccinated yet needs to get vaccinated because they're widely available in the United States. And we're seeing the generalizability of that data to the population. In other words, the vaccines are working quite well and are extremely safe. Now, there have been a couple of safety signals detected, which is as expected. We have a very sophisticated vaccine adverse event reporting system in the United States. So doctors or patients can report adverse events associated with vaccine. And we really have only detected the clotting problem associated with J&J, very, very low incidence, and a number of other side effects that we are monitoring. But by far, the vaccine is much more efficacious, and the risks of any side effects extremely low, so that it's recommended to get vaccinated. So again, positive news that we're seeing as more and more people get vaccinated, as we approach more getting to that level of herd immunity, that magic number of about 75%, we're seeing the case rates and the death rates drop. But here's another important number to know, that the average daily cases is still over 14,000 in America, and the average number of deaths per day is 418. So we are making progress, but we're not out of the woods yet. Okay, so we need to continue to get vaccinated. More and more people get vaccinated so that we can contain the virus. All right. Now, our researchers and our public health officials are monitoring for variants, are monitoring whether the vaccines hold up against these variants, and so far, so good. So again, we are monitoring for variants coming into this country, and it's probably likely that we will have to have booster shots within 1 to 2 years, although we still don't know the timing of that. So there's a number of things happening. First and foremost, I just want to recap. If you haven't been vaccinated, get vaccinated. If you have had COVID-19 disease and recovered, it is still recommended that you get vaccinated because the vaccine is very protective against variants of COVID-19 and because it has a more durable, lasting antibodies against the virus. Number 3 important point is don't mix vaccines. So if you started with Moderna, the second shot should be Moderna. Same thing with Pfizer. First shot Pfizer, second shot should be Pfizer, okay? Other kinds of vaccines, like say, for example, the shingles vaccine, you would want to wait 2 weeks till you're fully vaccinated with COVID-19 and then consider with your clinicians the need for other kinds of vaccines that are recommended for your age group. Okay, so you want to space them at least 2 weeks apart from each other. All right, so that's about vaccines. Okay, there is a great deal in the press with regards to understanding the origins of COVID-19 disease. That is important to understand how the virus was transmitted to humans. That's very important to understand the cause, the mechanisms, so that we can prevent future transmissions to humans of COVID-19 disease. But there is no place for attacking researchers and healthcare workers and scientists. I think as we have followed the epidemic over the last year and a half, we have seen the evolution and the emergence of scientific data. We have adjusted recommendations accordingly. We have developed 3 very effective vaccines in the United States, adjusted again the public health recommendations from the CDC accordingly of whether you're vaccinated or not vaccinated and how to social distance, wear masks when needed, and so forth. It's an evolution of scientific data, scientific discovery, and scientific facts. And there's no reason or logical need to attack individuals in the United States for this pandemic. Although I can think of a couple, but I won't name them, okay? I won't name them. Anyways, but the importance, again, is to learn the facts, to get the knowledge, to go to reliable sources, to go to the experts, to go to the CDC, to go to your doctor, to get the facts of what you should and shouldn't do, okay? And not to cast blame to any one individual of why we have so many deaths and cases in America today. That's not going to help anyone, but medical science is going to help everyone. Okay, so once we get the pandemic under control in the United States, then, as we're starting to do now, we need to ship vaccine out to other countries, poorer countries that don't have access to the vaccine, to get the virus under control there as well. Because until we can really get the burden of disease controlled throughout the world, then we're always going to be at risk that a new variant could come into the United States, which is more contagious and more virulent, more disease-causing again. So it's all important that we work together as Americans and that we work with other countries again to eradicate this disease. The other really important concept that I tried to stress throughout the past season was the wonders of medical science and medical research. And I started studying medications in the 80s. Modern medicine maybe starting around in the 40s and 50s, you know, with the emergence of drugs such as penicillin, other antibiotics, anti-tuberculosis drugs, drugs for diabetes, insulin, polio vaccine. I mean, the emergence of these medications and vaccines have really made a difference in improving the quality of life for patients, right? And as we evolved and started approaching and we got into the big spearhead for cancer research, and I have seen over several decades now the progress that has been made in different types of cancer and understanding the biology, understanding targeted therapies, immunotherapies, chemotherapies, how best to utilize them to improve patient-reported outcomes, but also to improve survival. And we've made tremendous progress. And then with AIDS and the emergence of AIDS, the community and the activists that stood up and said more needs to be done. Patients need to have access to drugs that fight HIV. And they worked with the NIH and the CDC and became a part of the councils for recommending drugs to be released earlier so that patients would have access. And now it's standard that patients and patient advocates are on these councils, working side by side, the scientists and the medical researchers can make decisions about access before a drug is approved, compassionate use of drugs before a drug is approved in various countries throughout the world. And so those are great things. But the research that was done with AIDS and antiviral research really gave us a lot of fundamental knowledge on how to attack these viruses, which helps us now to develop antiviral therapies against COVID-19. And all the research that's been done, whether it be in cancer research or AIDS research, have helped us develop platforms such as the messenger RNA platform, which allows us now to rapidly, within less than a year, develop a vaccine for a new virus or a new strain of a virus. So you can see the evolution of medicine, the science of treating human disease, the epidemiology studying the distribution and the determinants and the causality of human disease. And you can see the progress that is being made and the rapid response. So when we give resources to these agencies like the NCI, the NIH, the FDA, again, we're seeing the benefits in our ability to attack COVID-19 disease, and they kind of go back and forth with each other. So now there's a resurgence in perhaps finally getting a vaccine for HIV, which has not been successful in the past. But now with the new messenger RNA technology we have, that may possibly be possible. So again, a great deal of progress has been made. We understand a lot about the human body, the immune system, the pathogens, the origins of disease. And so we can be very optimistic, cautiously optimistic that we can contain COVID-19. So I wanted to make that point. Hopefully I was able to articulate that okay. There's a lot more of research that we need to do. We still need to develop a vaccine for children that is safe and effective. We're looking towards the fall or the end of the year where that may be available. We have to continue surveillance of variants of COVID-19 to see if these strains are more contagious or more virulent. We have to study outbreaks of COVID-19 disease. We have to deliver effectively vaccines to the rest of the world, again, as I stated earlier, to get the vaccine under control. We need to continue to modify vaccines for different strains if needed. We need to understand the durability of the current vaccines. How long do we have immunity for, whether you had the natural disease of COVID-19, how long do those antibodies typically last? And with the various vaccines available now, how long do the antibodies last against COVID-19 for those people who received the vaccine? That'll determine whether or not we need booster shots or not. Again, we may need additional vaccines for new strains of COVID-19. And we have to continue doing correlative studies and understanding how the vaccines are impacting the populations under investigation. So there's still a great deal of research to do. And I might also add is we need additional antiviral agents. So right now, if someone was diagnosed with COVID-19 disease, and it's still happening on a daily basis in the United States, okay, you want to self-quarantine and you want to call your doctor when you have a positive COVID-19 test. And then they're going to instruct you to monitor your symptoms. Okay, and if your disease is progressing and you're having shortness of breath and difficulty in breathing, oxygen levels decreasing according to a pulse oximeter, you may need to be hospitalized. And during this time, you want to ask and be proactive. Again, I try to teach the Pharmative audience out there, the Pharmative members out there, be proactive. Know as much as you can know about disease and medicine and ask about them. You want to ask for the monoclonal antibodies because right now, if you get them, they're available through various infusion centers throughout the country and they're available for free. They're very effective at getting these antibodies infused into you, which will crush the COVID-19 virus. That's the most effective treatment we have with people for COVID-19 disease. We do have an antiviral agent. We do have corticosteroids. We're better at supportive care for COVID-19 disease. But really the most effective set of agents in our armamentarium is the monoclonal antibodies, often referred to as the cocktails. So again, if you know of someone with COVID-19 disease and they're deteriorating, ask about getting COVID-19 monoclonal antibodies. That may mean you may have to ask for an infectious disease specialist and whether you're a candidate for the COVID-19 monoclonal antibodies because not everybody fits the criteria. Okay, for the vaccinated people, we can enjoy going maskless. We still have to abide by restrictions on transportation, public transportation, planes, trains, buses, wear masks. We can congregate with other people that are fully vaccinated as well, which is great news. Local businesses and certain cities and states still require masks in businesses, so you need to understand whether a mask is required or not for those people that are vaccinated. So there's a number of great benefits, and you can rest assured that you are very well protected against COVID-19 if you are fully vaccinated, which is 2 weeks after your last shot. For those of you who have chosen not to get vaccinated, you still have to practice social distancing, avoid large crowds, wear your masks at all times, stay home as much as possible. Do not go to large-scale events because you are possibly a carrier of the disease and you could possibly be spreading the disease. So you don't have those advantages. You shouldn't even travel, and you should work at home when possible if you have chosen not to be vaccinated. And again, I'll be very blatant to say, not getting vaccinated means you're stupid and means you're selfish, period. Because there's no reason why you shouldn't get vaccinated. The vaccines are very safe, very effective, very low incidence of side effects. I'm fully vaccinated. Everyone I know is fully vaccinated. And again, those people that live in more rural areas or poor areas, let's reach out to them and help them get vaccinated too. We're only at a level of 41% of fully vaccinated people in the United States. We still have a long ways to go. So I'm cautiously optimistic. There's a light at the end of the tunnel, but there's still a lot of work that needs to get done. And this virus is unpredictable. And not only do we have to worry about the short-term complications, we have to worry about the long-term complications. So even once you've recovered from COVID-19 disease, you could still have residual lung scarring, cardiotoxicity, and neurotoxicity. You can even have a higher risk of stroke, dementia. So again, and there are probably unknown risks we still don't know. So you don't want to get COVID-19, so you want to prevent it. That's the best approach right now. We have 3 vaccines, so there's no reason not to get vaccinated. So get vaccinated today if you haven't gotten vaccinated, and do the Pharmative vaccine challenge. Get out there, get people vaccinated. Again, we still have the majority of Americans not fully vaccinated. Okay? And it's really unfair to the communities that you live in not to get vaccinated. All right. We are making progress. I only have a few more notes to go through here. I think I'm actually going to close on that note. Be cautiously optimistic but it's not like a faucet that you turn it on and you turn it off, right? It's a gradient. We're slowly seeing the reduction in cases and deaths of COVID-19, but we're not over it yet. And our biggest fear is that we would go through another wave of the pandemic. And the more and more people that are vaccinated, the less and less likely that is that we would see another wave. Okay, so we really, really need to get our people vaccinated out there. The people in the rural areas, the poor areas. And the unfortunate thing is there is this huge disparity in the United States. Poor people don't have access to healthcare like the average American citizen. People black and brown don't have access to healthcare. People that have comorbidities suffer more with COVID-19 disease. Get vaccinated. And if you do end up with COVID-19 disease, continuously evaluate whether you're a candidate for monoclonal antibodies. The drug called remdesivir, not that good of an antiviral agent. And those are for the very sick patients. It's been demonstrated to shorten hospitalization stay, but it has not been demonstrated to improve overall survival. We're much better at supportive care therapy with oxygenation of therapy and improving the oxygenation, using corticosteroids like dexamethasone and so forth. But again, you don't want to get the disease. You want to get vaccinated. So until I see you in the fall, I wish you to stay healthy, as it's easier to prevent disease than to treat disease. And you can always send me your questions. I'll do my best to answer them to info@pharmative.com. I'm Dr. James Partyka, and I'll see you for season 4 in the fall for Pharmative Live.